Hi, my name is Madison Ninneman, and this is Anthropology 102 with Dr. Humphrey at Northern Arizona University. Today, with my group of Tyler Ford and Carter Mahaney, we will be discussing the readings of A Community of Addicted Bodies from the book Righteous Dope Fiend by Borges and Schonberg, 2009. Today, we will be discussing the contributing factors that led up to heroin abuse and the effects it holds on different ethnicities. As described in the book, heroin is not simply psychological dependency or emotional craving, but it is psychological, deeply embodied at the cellular level of functioning. To go deeper into this quote, this shows that not all addictions are present due to accidental findings, but rather have been there their whole lives. The homeless are not throwing away the money they don't have, but are rather viewing this as a survival instinct. The homeless are sharing what little money they have to get a fix they feel will last them a day, but it's never enough. People that want to help with the heroin addicts on the street feel that they can't because they're putting someone else's life before another's, because there are always other people who are overdosing on the street as well. Friendships and reputations are constantly ruined within this community because everyone is trying to get their fix as quickly as possible and will leave when they see a better opportunity present. Heroin injectors tend to brag about their capabilities of injecting multiple times a day. This leads into the racialization and competition of drugs. The whites of this community would give racial names to crack even though they did it too, but felt that it was only used by African Americans. African Americans would have parties called speedball sessions, which includes flushing the blood in and out through a syringe to get a rush. Although this was considered an African American event, whites also participated. African Americans were thorough with maintaining a public appearance, which meant making these sessions look like they were for fun. Meanwhile, the whites would make themselves look depressed. Some even said they did not enjoy injecting anymore. The whites would also not spend time looking for a viable vein to use and would push the heroin under their fat, causing abscesses that would later pop. African Americans were the opposite and would spend up to 45 minutes looking for a good vein and avoiding abscesses altogether. With syringes being passed around, HIV and hepatitis C are common in these rundown areas. While African Americans were maintaining their appearance, they would typically dress to the fashion at that time. Meanwhile, whites would dress in ripped jeans and would not look presentable. It is mentioned that African Americans and Latinos were more likely to self-identify, but whites were more likely to blame PTSD for their drug addiction. Many claimed to be veterans and would blame their problems on war. Some are even mentioned to have lied about their PTSD and sought out to have something to blame their addiction on. African Americans would talk about the whites lying about their PTSD or bringing it to extremes when they had PTSD too, but did not blame their addiction on it. Some are even mentioned to not even have been in combat. Many of these men and women have PTSD, but is linked to their childhood and street life, not from war.
Medical complications. The predominantly white practice of skin popping has resulted in a gruesome, disfiguring medical experience for these individuals. As a result of injecting heroin into one's flesh without targeting a vein, the formation of purulent-filled abscesses on the body takes place. The development of these abscesses derives from the possibility of using a dirty needle or syringe, as well as not cleaning the skin prior to injection. So the culmination of bacteria from either the needle, syringe, skin, or all three creates an infection, which can develop into an abscess. Unfortunately, the conditions these people endure each and every day does not promote the use of sterile technique in drug administration. Due to the unsanitary conditions, abscesses are extremely common in those who skin pop. Their situations are not improved by the health system either. As a result of hostile emergency room practices, many indigent are forced to refrain from seeking medical attention until they are actually on the verge of death. Addicts tend to have consistent and reoccurring ailments, so some medical professionals are unenthusiastic to treat the same patient on multiple occasions. Many healthcare professionals are unable to relate to the plight of homeless drug addicts, thus are many times unsympathetic to their situations. Because they do not have medical insurance, the indigent are frequently turned away by the emergency room staff, unless they are showing dramatic signs of life-threatening illness. Oftentimes, a gaping abscess is written off as not being in need of immediate treatment. Those with these conditions are forced to wait in excruciating pain before being seen by anyone. Others are simply turned away. In the case of a man by the name of Scotty, he has learned from past experience that emergency rooms will turn him away unless he was showing severe health complications. When I start swelling up with an abscess, I gotta make sure it's fucking ripe enough and infected enough, and I got a fever that's wicked enough for them to take me in and give me part of the help that I need. We're not allowed to just go in there and try to get help, he says. Others, such as Hank, try to avoid the hospital altogether by treating themselves in unsterile conditions, which can lead to more severe complications. In graphic detail, Jeff's field notes describe one of Hank's DIY medical treatments. This consisted of Hank plunging a pair of toenail clippers into the opening of his abscess in an attempt to remove the infection. Immediately afterwards, Hank proceeds to inject heroin directly into his wound. The plight of these people is far from over. A solution to providing medical care to all of them is very complex. Hopefully, as society and medical practices evolve and improve, so does the treatment and situation of these people as well.
Public health officials are attempting to help homeless people. However, they're often out of touch when it comes to this. A big reason why is because they have never been in the shoes of homeless people and lack first-hand experience. Many of the programs that these public health officials want to enact are disjointed and short-sighted. These public health officials are naive to the problems and fail to address the constraints that these homeless people are under. For example, in this article, the researchers went and asked Frank, who is a homeless person, about whether or not he shares needles. Once he said yes, they presented him with the public health message that Frank found to be offensive because the educational message didn't provide direct aid to him. Another instance that shows that public health researchers are disconnected from the population they seek to impact is that they offered the homeless to attend counseling, and in exchange they would get a $20 research compensation. However, homeless people did not take this counseling seriously and just went with the sole purpose of gaining $20, presumably to buy more drugs. This next section begins with a very strange title. To use the words pathogenic to describe law enforcement doesn't seem like a fitting term, as it is mainly used to describe disease as well as medical conditions. Homeless people can be very frustrated and angry with law enforcement because they feel like law enforcement is out to get them. The cops are regulators of poverty and drug abuse. This angers and humiliates homeless people because they feel as if the cops are trying to ruin their lives. In a way, the police are destabilizing daily lives of homeless people by coming in and shutting down the homeless camps. This article concludes with personal anecdotes about many of the struggles that homeless people face in their day-to-day lives. Specifically, the article finishes talking about abscesses, a common medical problem homeless people have. This is common with homeless people because they don't have the means to treat these wounds on them.